September marks Polycystic Ovarian Syndrome Awareness Month. PCOS, as it's called, it affects about 1 in 10 women, and it can impact everything from your fertility during your reproductive years to really your long-term health. So we want to welcome Dr. Caroline Bilbe, OB/GYN at Touro, to explain what women need to know about PCOS and how it can be managed. Thank you so much for being here.
Thank you for having me.
Absolutely. So let's talk about the original symptoms. Do you go in, you're thinking you're going in for your yearly, and how do you find out about PCOS?
Yeah, so I would say the most common way people are diagnosed when they're younger is menstrual irregularities. So you're either missing periods or you're having really irregular menstrual cycles. And then people also find other symptoms really bothersome, like hair growth on your face, hair growth on your chest. Those are not normal places that women grow hair. Thinning of the hair on your scalp can also be a sign. Things like acne or weight gain, particularly on your abdomen, those are also bothersome symptoms for women.
It's interesting because it's named polycystic, which means a lot of cysts, but you don't necessarily have a lot of cysts on the ovaries.
Not always. The diagnosis is mostly in 3 parts. Traditionally, it is based off of symptoms, so mainly those menstrual irregularities that we talked about, but also some blood work to check hormone levels, and then it can be diagnosed based on multiple cysts on your ovaries with a pelvic ultrasound, but you don't have to necessarily have that component to meet criteria for the syndrome.
How is it that it impacts women's reproduction?
So it's really a hormonal imbalance that prevents your body from being able to ovulate. And so that's why we get those menstrual irregularities. That's why you have some of the symptoms that causes other hormonal imbalances. But without ovulation, you can't get pregnant. And so that's why some of the treatments are really geared towards causing ovulation.
Is there anything that somebody can do to treat it naturally, or things like metformin still the way to treat it? And talk about what's available.
Yeah, I mean, treatment really depends on what a patient's goals are. So if you're trying to get pregnant, then like I mentioned, those fertility treatments are going to be really beneficial for you. If you're more symptoms focused, then lifestyle is a huge component. Studies show that even a very small amount of weight loss can improve your menstrual symptoms, can allow for ovulation, can even reduce symptoms like increased hair growth on the face. So lifestyle changes, weight loss, healthy eating, and exercise, those are things that we really need to be supporting our patients in, because it can help with those reproductive goals, but it can also help with their long-term health as well.
Dr. Bilbe, one of the things that keeps coming up in like all medicine, all practices, is just the importance of regulating your glucose and regulating your sugar intake. How does PCOS age in a person, and what are the lifelong conditions that you see stemming from this original diagnosis?
Yeah, so PCOS has traditionally been thought of as a reproductive condition, but it really is a metabolic one as well. It can increase your risk for things like type 2 diabetes, high blood pressure, high cholesterol. And so early diagnosis of this and recognizing your risk can help you make those lifestyle changes earlier. While this is a disease of reproductive years, so you won't have this disease past menopause, you will still have some of those implications of the type 2 diabetes, high blood pressure. So early diagnosis, lifestyle changes early on are really beneficial.
Awesome. Dr. Caroline Bilbe, thank you so much for really good information.
Thanks for having me.
We can always learn more about that one.